Good afternoon, everyone. It's great to talk about food sensitivities and zonulin while you eat lunch. It was an ingenious idea, and thank you very much for listening to the bio that my mom wrote that. She made it a little too long. I strongly apologize for that. Interesting. Food is a potentiator for inflammation. Food is also a potentiator for information. So we need to choose wisely. We need to speak about these with our patients. I fell into the crux of a supplement was an answer for everything, as opposed to what it says. The word supplement, supplemental to food, lifestyle, treatment, etc. So I found the ability to test for food sensitivities, adding the zonulin as a baseline marker for leaky gut in the right percentage, that zonulin should be positive. So if I were to ask somebody a question now, and I'm not going to ask because everybody's eating, what percentage would you think that zonulin should be positive based on the data that was correlated by Dr. Alessio Fasano? You would hear a wide range of positives. I guess I should give you the answer. It's about 21%. So some tests do 5, some do 50, and that doesn't mean that the person, if they don't have zonulin, doesn't mean they don't have leaky gut. So the point is to test the food sensitivity with the highest level of specificity and sensitivity, combine it with a leaky gut test, and maybe look at some unique components of the inflammatory system, and you've got a dual compartment trifecta test that's probably going to change how you practice in your office, or at least add to your proverbial toolbox. So, Sherry Rogers once said, "The road to health is paved with good intestines." So quickly, let's go over our objectives. Elucidate, I'm hoping everyone will be able to do, the value of an advanced laboratory blood test for diagnosing food sensitivities and zonulin. I believe there it's a baseline, whether you're a chiropractor, naturopath, medical doctor, pharmacist, whatever kind of practitioner you are. I'm hoping everybody will understand the importance of hidden or delayed symptoms in diagnosing food sensitivities. I'll say this a few times. From the time from ingestion to symptomology with a food sensitivity, that time frame can be 72 hours. There is no way I can guess if you're sensitive to a food. It's very rare that the patient is going to know, because how can you attribute 3 days later? Major takeaway. I'm going to attempting to discuss the interconnection between zonulin, increased intestinal permeability, and ultimately autoimmunity, the body attacking itself. I believe that one of our biggest problems is our inability to manage and modulate our inflammation. And if we can't, ultimately we may have some autoimmunity. And lastly, let's assess intestinal microbiomes and implement treatment options to heal broken barriers and to reduce inflammation. So what's the problem? Well, one of the biggest problems is the American population is unhealthy, and we're getting more and more unhealthy. And when you look at the numbers, they're staggering. Number one thing I'd like to talk about is the excessive amount of sugar consumption in America today. The average American consumes 160 pounds of sugar per year. Sugar works with the reward center in your brain. Sugar is the most overused, over-the-counter drug that we have in America today. When mice were offered the option of sugar versus cocaine, 94% of mice took the sugar over the cocaine. That's how addictive sugar is. Wheat consumption, and we could spend all day on wheat consumption. We know that there's the lectin, there's the gluten in the gluten arm, etc. Gluten means glue, sticks to the intestinal tract. Everybody knows that, etc. The average American consumes 146 pounds of wheat. When you combine that with sugar, the average American almost consumes a pound of sugar and wheat per day. And guess what? Wheat is one of the highest food sensitivities out there. And you'll see some data that it's deleterious to anybody who consumes it. Caloric sweeteners, the average American consumes 142 pounds of artificial sweeteners per year. Artificial sweeteners can damage the blood-brain barrier, pass the blood-brain barrier, and become a neurotoxin. Stevia, my favorite thing, raised my ALT, lowered my testosterone. You know, no guy likes to admit to that. So take the stevia out. Stevia has some damaging. So we're at the point where monk fruit is the play. And the only thing with monk fruit is you just can't cook with it. There's been a rise, Dr. Mark Hyman talked about diabesity, a prodigious rise between diabetes and obesity. We're getting heavier, blood sugar's going up, we're getting heavier. It's called diabesity. Joint pain, back pain. 8 out of 10 Americans have back pain at some point. Osteoarthritis. With my chiropractic background, I will tell you that osteoarthritis is a form of autoimmunity. It is not wear and tear. So if you go to the doctor and they say that, that's probably not a 2022 answer. NSAIDs, non-steroid anti-inflammatories, they decrease pain but impair healing. Nutraceuticals decrease pain and promote healing. Which do you want? NSAIDs, all those overused and over-the-counter NSAIDs, they damage the blood-brain barrier. They damage the intestinal tract and cause leaky gut. I'm not going to help you with any kind of muscle pain over a duration of time. And medications, obviously, we are one of the most I should correct myself. We are the most over-medicated country in the world today. We live in a toxic and stress-filled world, and it's been postulated by 2050 that half of Americans will have some symptomology of neurodegenerative disease. The bulk of neurodegenerative disease comes from gut issues, and again, maybe one of the unlooked at issues is food sensitivities in the gut. Gut factoids, 90% of the scientific literature describing the microbiome has been published in the last 5 years. We're 100 trillion bacterial cells. We're made out of 90% of our cells are bacteria, with 10% human cells. Now, if you just look at the human cells, you may be looking at something from a very myopic manner. Genetics is 99% DNA. So obviously, I am not anti-antibiotic, if I could say it like that. However, sometimes I think antibiotics are used in a very prophylactic manner. I took this from actually Hyman's podcast. I really liked it. I liked what he listed as his 5 causes of autoimmune disease. Number 1, toxins, internal and external toxins. Number 2, allergens, food sensitivities. 3, microbes, dysbiosis in the microbiome, the epicenter of our health. A poor diet. Who has a worse acronym than SAD? The Standard American Diet. And stress. I was having the stress this morning, physiological and physical. I was freaking out. But then again, when you come from New York with a Jewish mother and you have a type A personality, it will happen on occasion. No doubt. 72% of US adults say they have experienced GI symptoms a few times a month or more. Several times a month. I think we should ask our patients. 74% of participants have lived with their GI symptoms for more than 6 months, and 56% of them never told their primary care physician about it. Just because somebody doesn't say it doesn't mean it doesn't exist. Everybody seems to be having some sort of gut barrier issue. Inflammation, the driver of chronic disease, hidden or silent. It's a problem, a cause of many chronic diseases. And I think part of the problem is the adipocytes and the adipose tissues. In the adipose tissues, they're spewing damaging chemicals, inflammatory chemicals. They are not your friend. Fat cells are depositories for toxins. If you have a food sensitivity and a damaged barrier, you're not going to absorb food as well. And guess what? Since you're not going to absorb it, what are you going to do to the caloric content? You're going to store it at its basic idea. If your gut is not healthy, you are not healthy. That's not what I tell you as practitioners. That's what I tell my patients. If your gut's not healthy, you're not healthy, because they always ask for a very simplistic takeaway. So let me ask everybody in here, do your patients, when they walk in your office, do they want to lose weight? Without question. Number 2, do they want to lower their blood pressure when they find out that their blood pressure is too high? Do they want to lower their fasting blood sugar or insulin levels? Avoid metabolic syndrome. 3 out of 5. I get 1 just because I get older. Not fair. How about resolve some of their gut issues? Like stop passing gas in church. How about avoid autoimmune symptoms and conditions? How about decrease their fatigue? Isn't that the number 1 complaint about most patients come in your office? They complain about fatigue. So the FIT test, the food inflammation test, why practitioners should use it. It allows for immune complex issues and inflammation that can be associated with foods underlying a problem for the conditions that you and I both see every day in our office. Food sensitivities, inflammation, and gut permeability in one test. Food sensitivities, inflammation, and gut permeability all in one test. Trifecta, like I said, that'll really understand if any one of these are wrong, how that will lead to a sequela of other issues down the line. What are triggers of gut permeability? These are just some of them. I mean, we could have a cornucopia list of things. Antibiotics, need we say anything more? Nuclear weapons to the gut. They have their place, but again, nuclear weapons. Acid blocking drugs. Did you know PPI increases your incidence of positivity to COVID and your death rate precipitously? NSAIDs, we talked about that a little before, bad for your barriers. Heavy metal exposure. Environmental toxins. Woo, we could talk about detox all day long. And an environmental toxin. I mean, it's in the air, right? We just can't see it. Concussion. I'm big on concussion. Whatever you do to your brain, you do to your gut. Whatever you do to your gut, you do to your brain. 60% of people post-concussion have shown to have either leaky gut or small intestinal bacteria overgrowth because of the decreased tone in the vagus nerve, which also can be adversely affected from any kind of damage to your gut because that has a direct communication, which I will show in some succeeding slides. Cesarean birth, as we all know, Staph aureus versus the natural appropriate microflora going through the vaginal region. Liver toxicity, bidirectional. The body's all interconnected. Bidirectional, bidirectionality between the liver and the gut, in the gut, in the liver, the portal vein, blood stream, etc. Gut dysbiosis, an unleveling of good and bad bacteria. Anybody want to take a shot at what percentage of good bacteria you're supposed to have not to have good dysbiosis? It's an open-ended question. Anybody? There's no wrong answer. I'm sorry, I heard somebody say something. Sorry? 80%, 80 to 85%, correct. And then it has to work with the host in an appropriate manner. But yeah, 80 to 80, it's not like I win the presidency of the room because I get one more vote than you. It's 80 to 85%, so that's a work in progress every day. Food sensitivities, well, we'll spend a lot of time on that. Yeast, bacteria overgrowth, chronic stress, sleep deprivation, chronic inflammation, alcohol, gluten, dairy, GPS, DNA, don't forget them. GPS, no gluten, no processed food, no sugar. DNA, no dairy, no nicotine, no artificial sweeteners. Sugars in there, artificial sweeteners, and food additives and emulsifiers. To piggyback on what I just said with the emulsifiers, they've shown to actually drive intestinal inflammation. I'm all about supplements. I just want to know what it's binded in and any additives that they may have had to it so I know how to deal with it, to what extent, and etc. Because if you compare and contrast, if I may, with organic food, organic means 95% organic. So the takeaway is I'm aware that there's nothing perfect in this world. I tell my patients that. But you need to do the best you can because it's your health. Because as Jim Rohn once said, take care of your body. It's the only place you have to live. The effect of selected food additives on the colon, disruption of mucosal barrier, ingestion of microorganisms leading to a pro-inflammatory cytokine release of TNF-alpha cytokines leading to inflammation. My favorite, because I put my name on it, Dr. Rob's Gut Matrix. Now, I could have more arrows, I could have more organs, and I would actually need more time. So when you take a look at the gut, it's very simple. When we say the word gut, what are we talking about? The small and the large intestine. Interestingly enough, the small intestine is a misnomer. It's not small, it's extremely long. It's about 90 to 95% of the length. It's 20 to 52 feet, depending on the individual in length. It's got a single layer epithelial cell, and its thickness is that of a wet paper towel. When you unravel it to look at the surface area, it has a surface area of a tennis to a basketball court. And obviously the large intestine, the reason they call it large is because it has a very, or in comparison to the small intestine, a wide diameter. The small intestine has a small diameter. The purpose of the small intestine, as we all know, is to allow micro or small digestible food particles, vitamins, minerals, and water to seep through, and then push it to the large intestine and out, and you guys all know that. Here we have the idea of dysbiosis, unleveling of good and bad bacteria, leaky gut, which we can go into more detail. hit the food sensitivities in LPS, lipopolysaccharide and endotoxin that holds gram-negative bacteria on the inside of the intestinal wall. When it's expressed, we obviously have systemic inflammation. Leaky gut, overload of toxic chemicals to the liver. Everybody always asks me, do you do the liver first or do you do the gut first when you put someone on a program? In my seminar program, I think you can do them together. I don't see any other way. It used to be, well, we take this subject. Remember these subjective handouts? Well, if it's 10 on this one and it's 9 on the other, they're interconnected. You got to do them together. So I do detox with all my gut protocols. You have a leaky gut, you have a higher incidence of insulin issues, a higher incidence of obesity, body composition, autoimmunity, hence the idea of thyroid being there. Leaky gut, or the release of LPS, increases the incidence of heart attacks by 3 times. Gut to lung axis is huge, became very big with COVID. And again, with a chiropractic background, musculoskeletal. When you have leaky gut, you have an increased release of cytokines and MMPSs, which lead you down a path of more soft tissue and joint injuries. MMPSs eat up your brain barrier. MMPSs also eat up fibrocartilage, which is like your disc. So if someone were to come in with a lower back herniated disc issue, of course I would evaluate that, but to evaluate the patient, I want to look at their gut permeability. And the last thing is the gut to brain axis. How quick do you think your brain speaks to your gut? It's a millisecond. So whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. So a very basic PowerPoint. Here we've got healthy cell or tight junctions. So zonulin is not being expressed, the protein structures. By the way, there are 40 protein enzymes in a tight junction. There's 40, there's not 2, there's 40. There's your microvilli, shaggy carpet. Things that grab nutrients. They, by the way, also have digestive enzyme in them. And you have the depiction of the small white balls, which are small digestible food particles, which are going through, and the big balls are the large undigested food particles, macromolecules, which are not able to go through, and they're sent to the large intestine to be eliminated. However, conversely, damaged gut junctions, you also have damaged villi poor absorption. You're seeing both slip through. You're seeing the start of an immune reaction when that protein goes through the gut. And it stimulates the immune system, and we can go through it, which is important. And the immune system then takes a macrophage, presents an antigen. The antigen gets attacked by T cells, ultimately probably making some B cells, et cetera, in some molecular mimicry, attacking some other structures that have a similar protein sequence. Was that fast enough? So Alessio Fasano once said, the gut is not Vegas. What happens in the gut doesn't necessarily stay in the gut. So there was a 6-month follow-up of the gut microbiota in patients with COVID-19. I find this amazing because the virus shed through the gut. So patients with lower post-covalence richness show higher levels of C-reactive protein and illness during the acute phase. So there was a persistent reduction of the gut microbiota richness, which may have a long-term biological influence during COVID-19 pandemic. So one of the leading causes of the long COVID is clearly gut permeability. There was just a huge article in the New York Times, which did a retrospective study and found out there were some people with long COVID that had long COVID for up to 2 years. So COVID's impact on the GI tract, loss of diversity, loss of beneficial bacteria, expansion of pro-inflammatory bacteria, expansion of yeast, increased incidence of leaky gut. Leaky gut COVID is linked to increased incidence of heart disease. Talked about that a little before. So severe COVID implications linked to gut barrier issues. So the disruption of the gut microbiome also damages the liver. Believe it or not, your lower level of your lung health is depicted on your gut microbiome. Upper is more of your nasopharynx. So when we were seeing a lot of issues before in the lung, we were seeing them because of the gut, and the dysbiosis was going from the gut to the lung. So lung damage interrupts crosstalk between lung cells and the gut microbiome, triggers systemic inflammation, causes gut barrier breakdown, and gut microbes cross the gut, enter the circulation, and typically worsen lung injury. So let's take a real good look. And if you can really take a look, you'll see occludin and zonulin there. So occludin, Zo1, and zonulin. Zonulin is a marker that implies damage. It is not the marker of the structure damage. That's a big takeaway. Zonulin is a marker of damage. When you see it expressed, you know these other structures now have been compromised. Everybody, oh, zonulin, no. So I want to make that clear. Inflammation promotes excessive gut permeability, increase in tight junction permeability in severe COVID, steep increase in zonulin release. Increased zonulin is a marker for higher mortality in severe COVID. LPS is also expressed in severe COVID, and occludin is also elevated, which is a structural protein enzyme. So now we have microbial translocation associated with systemic inflammation. Many of these markers, interleukin-6, interleukin-1 beta, C-reactive protein, and of course D-dimer. Interleukin-6 and D-dimer were backbones. They were the cornerstone of what people were testing with COVID-19. So they are great systemic inflammation markers, and some of our systemic inflammation clearly comes from the compromise of our gut. So I would propose to you that we want to always be able to get a very valid test to see the status of people's gut health. So gut permeability modulates metabolite levels in severe COVID-19. Abnormalities in glycation causes dysregulation of inflammation. So let's talk about the gut-to-brain axis, getting to the root cause of the broken brain. So here we have blood vessels in the gut getting communicated with via the microbes. We also have something called the neuropod, which I'm going to break into and really explain. That neuropod is a structure that's on the intestinal tract that communicates with the vagus nerve. Your vagus nerve is your main communicator between your gut and your brain and your brain and your gut. One of the biggest reasons that people get SIBO, a contributor, is because vagus nerve tone is decreased. When it's decreased, IBS and IBD are increased. There's a decrease in pancreatic cells. There's a decrease in all digestive enzymes and tone, and people overlook that. So again, we have enteroendocrine cells, and lastly, we've got immune and inflammation cells because the gut communicates with our immune system. Or very easily, as we see that when we have a compromise in the gut, we've got an increase of toxins in the bloodstream because they've burrowed their way through the mucous membrane. Whoops, wrong button. Mucous membrane right here. They get into the bloodstream. Then you have an IgG, IgA, and IgM, B and T cell release. You're ultimately getting nutrient malabsorption, autoimmunity, food sensitivities, blood-brain barrier, and systemic inflammation. The next slide clearly depicts the release of LPS and amyloids from the gut. That release of amyloid from the gut goes to the brain. It is one of the contributing factors to Alzheimer's. We all know that the plaquing, or amyloid plaquing, tau tangles, is the end result. It is not the root cause resolution. Leaky gut as a diagnosis is not root cause resolution. I'm sure if I asked everybody in here, give me some reasons why someone had a leaky gut, we would have a list of up to 50 really fast. It's a diagnosis, leaky gut, increased intestinal permeability, but root cause resolution is pinning how many items are damaging that gut. The gut and Parkinson's disease, another one, a bidirectional pathway. The role of the gut microbiome and autism. Gut microbiome is associated with autism. It alters immune system and metabolism, higher intestinal permeability with higher antigenic load from the GI tract. LPS is increased in autism. There's a less diverse gut microbiome. Up to 90% of people with autism suffer gut problems. So here's my take. Let's speed it up a little bit. My take on food sensitivity's effect on health. Obviously an increase in systemic inflammation response. Skin, it's your first barrier of your immune system. It will show that there's something going on at the gut level. Joint pain, trust me, if I were to take a survey for the patients that walked in my office from the chiropractic section, you would be astonished at how many have a generator of the gut, but they're coming into the chiropractor and they want me to adjust their elbow because they have elbow pain, or they want me to work on their tennis elbow, the extensor carpi radialis brevis and longus, not understanding that the elbow is part of that body called that unit, and then not looking at what is going on inside the body. Muscle pain and tightness, GI symptoms, all from food sensitivities, brain fog, anxiety, depression, mood, neurodegeneration, autoimmune issues, fatigue, and body composition issues. So a lot of people ask me what happened first, the food sensitivities or the leaky gut? Because food sensitivities to me show that there's a problem with the gut and there's probably a problem with digestion. I don't have an answer to that. It's just a ponder, but key factor in the development of food sensitivities is intestinal barrier dysfunction, which can be damaged or influenced by the gut microorganisms and pathogens through multiple pathways. So I broke down this little flowchart, if you will. I'm a big believer in detecting. I like a baseline. I want to detect. I don't want to guess. I want to test and not guess. If I talk to my medical doctor colleagues, I don't want to say, I think. They want to know what my diagnosis was based on. They want me to work the patient up appropriately. So with that being said, I want to see the triggers. I clearly want to remove the triggers, like proteins, infections, toxins, chemicals, and pathogens. I also want to repair barriers, skin, gut barrier, blood-brain barrier, and I want the body to be able to communicate or harmonize. So I want to remove, repair, and harmonize, because I believe the body is an interconnected organism, and when there's a system communication failure, you have disease. And I think one of the more overlooked triggers is our nervous system. And I talked about it a little in the vagus nerve. I think we overlook its impact on what's going on in our overall health as a communication, because it innervates everything from the medulla oblongata down through the transverse colon. It has a parasympathetic branch for everything. So it's a major player in what we do. So let's look at an overview of different kinds of food sensitivities. Number one, food sensitivities are related diseases that affect at least 100 million people worldwide. Number two, the prevalence of food sensitivity has increased drastically. It's over 50% increase in adults and over 70, it's not there now, but it's over 70 in children in the past few years. Symptoms, they come from a variety of skin rashes, headaches, to chronic intestinal diseases. 90%, and this should come as no surprise to anybody here, 90% of the sensitivities are in 8 food groups: milk, soy, eggs, wheat, peanuts, tree nuts, fish, and shellfish. Does that surprise anybody here? Did we miss anything? 90%. One of the foods in each specific group may cause a food sensitivity. So you can, in theory, have foods in a food group that would cause cross-reactivity also. How deep do you want to go? Where in the rabbit hole do you want to be? Food sensitivities, as we talked about before, occur 4 hours to 72 hours after the time of ingestion. If you have a food allergy, which we're going to talk about coming up in the next slide, you know it in about an hour, right? You itch, you red, you know it. Get rhubarb, the whole bit. Food sensitivity, again, we don't know. So if we don't know it, we don't think it exists. And that may not necessarily be a good way to think, if you will. Delayed food sensitivities are called by IgG 1 through 4 and immune complexes that activate the complement inflammatory process. We talk about immune system all the time, and we don't talk about the complement, the secondary tier in the innate immune system. Incidentally, IgG is important. Most food sensitivity tests, not all, most do IgG 1 and 2. The number one stimulator for complement is IgG3, which is only 7% of the IgGs. So you really want to do IgG 1 through 4. 4 not as big, but 3, big one for the complement. So let's take a look, and we could spend an hour on this slide. So ultimately what you're seeing is the foods and additives enter the gut. And you can see through the different pathways, you're seeing a breakdown of the gut into a leaky gut. You're also seeing, when most people don't realize, if you don't fix the leaky gut, ultimately you'll have autoimmunity at the gut level. I call it a boomerang. It starts here, goes through the body, comes back, and boomerang and damages the gut. So ultimately, what are you going to have? You're going to have what we call an antibody and antigen response. We've seen that, right? An antibody and an antigen response. When you have that, you get something called immune complexes. They deposit in tissues, they activate your immune system or the complement portion of your immune system. That causes inflammation, and now you have inflammatory symptoms. So to have a food sensitivity test, that tests for complement also. I mean, it's very different, it's very unique, and it's the only one out there that does that. And it's explaining that when you have a food sensitivity, you're also getting inflammation to the food. You're also testing for the IgGs, you're also testing the immune system. Are we cool with that? Guys, don't all jump up at once, I know it's Friday. Yes, ma'am?
What would you tell patients when they ask, well, isn't it just positive, the IgG positive, it's like,
It's a great question. She said, if I just ate something, wouldn't IgG be positive? Yeah, it could be. It's true. It could be. However, you're eating something that's causing your inflammation. So I'm going to take the food away from you, Mrs. Doe. And when I take the food away from you, I'm going to check now that your zonulin is high, or I'm thinking you may have leaky gut. I'm going to fix the problem. And when I fix the problem, we can either retest after a duration of time, or we can do the reintroduction through a diet and see if you get any kind of condition or symptomology in the 3 days. So it's great. Yeah, sure. Some people don't have it if they don't eat it. That is correct. However, they're eating it. So let's be real. Your patients eating gluten and dairy? When they come in, not after the part when you treat them. Do you think they are? Nobody's going to raise their hand to that. Okay. My patients come in and they eat dairy and gluten. They eat it all the time. My patients don't want to give up gluten and dairy. They don't want to give up sugar. They say there's nothing in this world to eat if they can't have gluten and dairy. I didn't know that cheese was on everybody's menu 24/7, 365. I didn't know that. I didn't know that Wonder Bread was on everybody's menu 24/7, 365. I get it, it's not so easy, but Dr. Valerie and I, we went out last night to eat. And I said, here's what I'd like. And they were like, okay, what would you like, sir? No gluten, no dairy, easy, and no vegetable oils. No vegetables, no. I don't want any cellular inflammation. And guess what? I got it. You know why? I just lied. Don't tell anybody I lied. My mom would be heartbroken. I said I was allergic to vegetable oils. So they go, oh, we have olive oil. Oh, you found the bottle. Isn't that great? Terrific. So great question, but I really want to hammer home that they are testing for the immune complex formation. And what does that mean? When you get to this slide in the immune complex formation, got it. So most people just test for IgG. Okay. And they may test for just IgG 1 and 2. Here, with KBMO, they're testing for not only IgG, they're testing for IgG 1 through 4, and they're adding the complement as a backup. So not only are you having an antibody response, you're also having an inflammation response. So in essence, what's going on? You're getting an innate and an adaptive immune response. Now, I don't know about you, but I don't want to turn my immune system on. I understand we're supposed to, but I don't want to turn it on and overwork it just because I'm eating a food I'm not supposed to eat. Makes sense to you, right? Food is a potentiator for inflammation. Bad food is a potentiator for inflammation. I say that to my patients all the time. Rob has one rule. Listen to Rob. Rule number 2, look at rule number 1. So let's have a little synopsis of where we are right now. We're about halfway through. Acquired immunity measures antibodies IgG 1 through 4. Innate immunity measures the complement, and the complement's interesting in that it's a C3D. I didn't really want to go through the pathway, but a C3D means if you don't stop it there, you're preparing it for lysis. C3D implies that there is a stimulation to the complement inflammatory pathway. So immune complexes that cause inflammation are underlying the problem for many conditions seen on a day-to-day basis. So let's get to zonulin. Everybody's familiar with that, right? So zonulin is a protein that can open the tight junctions. It's expressed and there's a structural damage. Gluten and intestinal bacteria are the main triggers for zonulin release. So again, just trying to blow it up and see that zonulin's increasing, implying that the protein structure is compromised. Stable gut microbiota, tight junction competency in the absence of zonulin pathway activation. Gut dysbiosis, excessive zonulin pathway activation, leading to abnormal intestinal permeability, actually leading to the release of cytokines, inflammation, and T-cell activation. So you have a loss of tolerance, or a loss of what we call oral tolerance. Let's take a bigger overview of zonulin. Number one, it's a protein that is synthesized in the intestinal and liver cells. It is a critical key biomarker for intestinal permeability. If the tight junction is open, you got a problem. It's the only reversible regulator of intestinal permeability. Elevated levels of the zonulin are associated with the following: autoimmune disease, adult glucose intolerance, celiac disease, IBD, obesity, non-celiac gluten sensitivity, rheumatoid arthritis, multiple sclerosis, type 1 diabetes, and juvenile non-alcoholic fatty liver disease, to name a few. So I think that's a great add to any test that you guys would want to consider. So let's look at this proposed chain of events leading to chronic inflammatory disease. So essentially 1, 2, 3, and 4, what you're seeing is the wider the junction is open, the higher increased, obviously, intestinal permeability, the more apt you are to have inflammation. This slide depicts what happens when somebody gets a tight junction to a, I call it a loose junction from zonulin because of COVID-19. You're seeing hyperinflammatory responses because the shedding of the virus damaged the integrity of the gut lining. Anybody have any questions on that so far? Because I'm going to do a quick synopsis. Are we good? Are you guys okay? You sure? Is it just lunch? Did anybody have gluten today? Well, I apologize. I actually had some gluten-free stuff. I cheated. Anybody have any? Who does food sensitivity tests in their office here? So you do food sensitivities? Okay. Sending out is fine. So you send out for food sensitivities, and you, ma'am? Food sensitivity. Who else? You do? So ample. How many people are interested in doing a food sensitivity test? So more hands. So people are understanding the importance of testing. You know, it's so funny. We in the field of functional medicine, if you will, in that genre, talk about gut all the time. And sometimes, I mean, I've done this myself. I've raced to the conclusion that they had a leaky gut without showing them their gut was leaky, or that there was a problem. I tell them to take away foods, and they don't want to listen. But when I come back with a color-coded graph test that this is you and these are your results, it makes an indelible mark on their decision-making process. So problems with zonulin protein measurement in ELISA assays. So there was a cross-reactivity before, haptoglobin and propionidin. And the problem is these were blocking zonulin binding. Most of the tests previous to this one had a very low positivity rate. So they're getting false negatives. So people walking around from our offices with leaky gut because the test wasn't as effective. And through progression, remember, there's always a struggle to get to progress. Now we have, which you'll see, a recombinant protein that's very specific to an antibody with the double test of the complement to really have a high sensitivity and specificity. The sample timing, it's very interesting. Zonulin does change during the day because the tight junction opens a little bit. Because remember, we have dendritic cells there that are like the periscope to the immune system, and they're always trying to open a little bit to test what's going on. So that number elevation isn't enough, especially when it's not the correct number. The number of elevation needs to be tied to the right IgG. zonulin IgG, just not a generic IgG. And the sample size, serum and fecal, well, here's your answers. Zonulin IgG antibody measurement resolves problems with the zonulin protein. It's a special recombinant zonulin protein. Very unique. It took about 3 years to get it right. It's a long time. That's a college degree. It took a long time. So eliminated all the problems with the other proteins in the cross-reactivity. It also eliminated zonulin blocking in these low positivity rates. I told you, the data came in and the data points virtually matched Fasano's Lancet article. It's about 21%. Now, I'm not going to ask anybody what test they used. I'm not going to ask them the percentage that they found, but it's about 21%. Again, that does not mean that there's not other damage to the gut or there's going to be other damages to the gut. It just means that tight junction is now compromised. Yes, ma'am?
Did you say in the previous slide that it varies in the serum?
Correct.
Because I just had a patient recently and I was calling about this data about something.
Don't say another company.
Sorry.
I don't want to get in trouble.
But they said that it was the opposite, that the fecal, and this is all new to me, I never heard about zonulin until recently, that the fecal one was the one that varied and that I should order the serum.
So you're looking at the X and you're jumping ahead of me, but that's okay. I like that.
The last slide.
Well, it said these are options. So the data that we found, and thank you for leading me to the promised land, is that IgG concentration is stable now, and it assures an accurate measurement, serum or blood spot. So the serum or the blood spots are the more effective test as far as the data is indicated to us. I love the blood spot because as a chiropractor, you really don't want me to draw blood. I'm bad at it. I mean, the last time I did that, I almost got sued. She married me, but you know, what can I say? But the bottom line is, you got the spot or the serum, whatever floats your boat. Just more, and I'll be honest, I have no problem with the poop test from anybody. But you tell me, are people more apt to prick their finger or take serum or poop in a French fry cup? I love the poop test, but the reality is this is more patient-friendly and more effective. So, the next generation zonulin, this is critical. Zonulin IgG antibody screening assay featuring unique recombinant zonulin protein. We're launching March 1st, 2022. It's exclusive to KBMO, the only one that has this very unique formula. Zonulin measures zonulin IgG antibody, more stable and specific marker than zonulin protein, and similarly positive rate by Dr. Fasano's breakthrough Lancet letter. It's an ELISA assay using a serum or blood spot, as this sample type is used in all of Fasano's research. They pretty much have the dream team. We're trying to find a third, but you got the two. Dr. Alessio Fasano, he's partnering with KBMO. Everybody knows who he is at Harvard. And Brent Dorval, I've had extensive talks with Brent. I give him the big thumbs up. He's a developer of the first rapid HIV test, and nobody, in my opinion, understands the complement process and the complement pathway better than he does. So in what we call the FIT 132, the food inflammation test 132, it's 132 foods, and the FIT 176, it'll include zonulin screening as soon as launch. And I can tell you that it's probably not going to be any difference in price. This will be a game changer for testing in your office. One quick takeaway, higher zonulin levels are associated with higher waist circumference, blood pressure, fasting glucose, and increased risk of metabolic disease. A little quickie, I like the fast test because it's fast. So basically take a look. It tests for eggs, milk, wheat. I'm not doing that whole test, blah, 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 blah. Do you get those patients? I know you do because they're mine also. So we take a fast test to get them started. The test is easy. You do it in the office. And as you can see, we use a control. That's the big red dot at the top. And you measure visually the coloring of eggs, milk, and wheat. And they'll get a real quick read on if they're if they're sensitive to something, and it really turns them on to start the process. So I use the fast test a lot in my office. I actually have a chiropractic intern all day long doing fast tests. That's my gig. So defective epithelial barriers are linked to a myriad of chronic diseases. Many of those chronic diseases are allergic conditions, food sensitivities, inflammatory bowel disorders, and celiac disease. In the interest of time, it's the innate versus the acquired. We all know the difference. So we have a barrier system. Our barrier system is our skin, and it's our digestive tract. The first time the outside world sees the inside world is when something passes through the small intestine to your bloodstream. That's the first part of your barrier. The innate immunity is your macrophages. They are your white blood cells. They're your neutrophils. They're your leukocytes. They are going to speak, and they are basically your Marines. They blow everything up, whereas your acquired immunity is your B and T cells, and your B cells ultimately, in a very epigrammatic fashion, make antibodies which catalog the pathogen, or really they catalog the antigen. Remember, the complement pathway is a portion of your innate immunity. So molecular mimicry, you're mimicking a molecule. The best way to describe this is that every molecule that passes your gut has what we call a protein sequence. It's like a zip code. Many of food proteins that pass your gut have a protein sequence that is similar to structures. For instance, dairy is extraordinarily similar to the cerebellum. Gluten is extraordinarily similar to the cerebellum. So the immune system gets confused, they look at the molecule, and ultimately they begin to attack themselves. So I call it a quandary or conundrum. What really is going on in somebody's mind? Well, native versus modern wheat. The modern wheat is small, it's dwarfed, it's thick, it's glutinous. It has been touched by man. Jack LaLanne, everybody's heard him, correct? Yes? Jack LaLanne was a chiropractor in 1936, and he said, if man makes it, I won't eat it. And he was never more right when it came to gluten. So the effect of gluten in this particular study, here we had 4 control groups: active celiac disease, celiac patients, remissions, non-celiac with gluten sensitivities, and non-celiac control, all had an increase in inflammation. Does not matter at the end of the day if you're allergic or sensitive, these things aren't good. However, if you have a sensitivity to gluten, you're going to get lit up like here. Here's your symptomologies. Check this out. Abdominal pain, bloating, constipation, diarrhea, flatulence, lactose intolerance. Let's look at the extraintestinal symptomologies: anemia, anxiety, joint pain, arthritis, depression, eczema, fatigue, headache, irritability, muscle pain, peripheral neuropathy. It looks like our practice every day of the week. So leaky gut may lead to autoimmune conditions. So here we have a hole in the gut, comes through the transmigration of an antigen through the leaky gut, bacteria, virus, microbe, and a protein. In signals the B and T cells. Those B and T cells form antibodies. They attack the antigen, they recognize, and they memorize it. But unfortunately, those antibodies get confused with self because the protein sequence is similar. In this instance, it's very similar to the knee joint. So if it's in the synovial space, it's rheumatoid arthritis. If it's in the joint space, it's osteoarthritis. And autoimmunity is the body attacking itself. So much so that the role of the gut in the microbes and the pathogen of spondyloarthritis are very similar. Here in this study, as I speed up, half of the people who have spondyloarthritis have a gut problem. So people coming in that have damage to their spine, 50% of them have a gut issue. And the takeaway was in the bottom, therapies targeting inflammation at both sites, both the gut and the spine, may be beneficial for spondyloarthritis patients with bowel inflammation. And lastly, I told you what the problem was. Let's get the solution. Let's talk a little bit about the role of nutrients in intestinal permeability. I have my Super 7R action plan. My Super 7R action plan is what I would do if someone had increased intestinal permeability. Number 1, reset. Reset what? Diet, lifestyle, mindset. Eat a better diet. We talked about it, GPS, DNA, lifestyle, mindset. Let them start thinking that health is wealth. The second one, and this is where you really kick in with the testing, where you want to remove. What do you want to remove? You want to remove triggers. That's where you want to take your allergens out. That's where you want to detox. That's where you want to take your food sensitivities out, your unwanted pathogens. You want to use serum bovine immunoglobulin. You want to use garlic. You want to use berberine, oregano oil, and take out all your pathogens so you have no antigens. The second R is replace. You want to replace needed digestive enzymes and stomach acids, increase bile, stomach acids, pancreatic enzymes, and the such. The fourth one is to regenerate. You're going to regenerate the damaged intestinal mucosa. You want to use a plethora of different nutrients that allow for the mucosal lining to heal and seal and create an anti-inflammatory environment in the gut. Not easy to do with food alone because a depleted cell can only be repleted by a large number of nutrients. So it's very hard by food alone. The fifth R is reinoculate. Reinoculate with what? Quality pre- and probiotics. You may make the statement now that the prebiotic may be more important than the probiotic. The prebiotic feeds the probiotic. That probiotic leaves a residue there that we call a postbiotic. You ain't going to have any postbiotics if you have food sensitivity, if you have inflammation, and if you have zonulin damaging your tight junctions. You're not leaving that residue that you need so very much. By the way, pre and probiotics, interestingly enough, prebiotic, probiotic, 1 + 1, if they don't match, maybe equals 1 or 2. If they match and they're synergistic, symbiotic, 1 + 1 equals 4. That's the new math. None of that happens if the gut environment is not in a pristine type condition. And 6, reintroduce certain foods. You have an option. You can reintroduce, say, Brussels sprouts you were sensitive to. You took it out. You could retest at this point, or you could reintroduce the Brussels sprouts. And lastly, you want to retain your health and your GI integrity. And you can do so by eating a good, healthy diet, no shot, multivitamin, multimineral, omega-3 fatty acids, vitamin D, probiotic, and maybe a good greens drink. These are, and James can give you the slides. I just wanted to make sure you had ample slides to look at, because I want to answer some questions. I know you guys were quiet, but I'm sure you have some questions. The superhighway to health, the gut-to-brain axis, is through optimum gut function. And before I answer some questions, for me, the meaning of life is to find your gift. Norman Cousins said this. The purpose of life is to give it away. You guys are here like I'm here. We could be doing something else. We're here because we're trying to get better at what we do to help more people. So never, ever let the struggle, the difficulty, the energy that you lose stop you from doing what you do. You've got the gift of health, and I applaud everybody here for sharing it with all your patients and everybody else. So if you guys have any questions, if you want to contact me, I will be at the KBMO exhibit in the exhibit hall. You guys can come by, check it out, get some information. And if you have any questions, I'm here now. What do you guys got? Yes, sir. How much is the test? James, would you answer that question for me?
So there's 3 panels. There's a fit 176, which is $385. There's a fit 132, which is $285. There's a fit 22, which is $100. And today, if any of you guys want to try the test, the big one's for $385 is reduced to $200, and the fit 132 is reduced to $285 and $150. So again, we encourage people to try the test, and then they get to review it with Dr. Brett or the circle bench. It's part of the routine testing test.
I'm sorry? Go ahead. The fast test, yes, ma'am. Yes.
That's $50.
It's fast. Yes.
Is the point of care test for the fast one, what aspects of the leak out is it
The point of at the point of the testing for the fast test, it's testing for Gluten. Gluten, yeah. Good question. Anybody else have any questions? You guys all right? You had a tough day? Hey, how are you? Well, this test doesn't test for anemia, but from the other labs I take, I find anemia to be pretty prominent. A good percentage of my patients have anemia. Yes. So any condition, or the bulk of conditions, I should phrase it like this, will definitely attenuate when you address the gut inflammation and food sensitivities. As long as, this is all about keeping the gut in a more, again, pristine condition. Anything you do because the gut is 80% of our immune cells, it's where our macro and micronutrients are absorbed. So clearly, many conditions will at least attenuate somewhat. Yes? What do I do about an antibody being positive? Well, great question. This is a confirmatory situation that you have leaky gut, and my 7R program is something that I've adopted to share with all of you to help the tight junction heal. So you're going to take away the triggers. You've already assessed the barriers, and then you're going to try and fix the gut at that level. So specific nutrients for like tight junction would be like a zinc carnosine. Yes, ma'am. No, you don't know, because if it's elevated, see, this is a specific, it's an antibody to zonulin. It may be an antibody in other tests to other proteins in the tight junction. So this is very specific, it's very unique now.
The treatment is safe if a patient has an elevated zonulin antibody. The treatment is safe if we eliminate those toxins, wherever the trigger factor, kill the gut. No big difference on the treatment side. So I say, okay, what's the selling point if I know not what to do with the zonulin?
I understand what you're saying, and I'm compelled by that you want to treat the patient. However, I believe by knowing precisely what's going on inside, that you now have a sniper telescope view to hit whatever you need, because leaky gut, well, what's leaky gut? Is it the tight junction? Is it the actomyosin damage at the level? Is it dysbiosis? Is it LPS? So those protocols change according to the structure and the environment, and if I can get a test that's accurate, where I can sniper clear what I want, I'm much more comfortable with that. I understand generically we treat leaky gut, and that's a great example of what we said before of leaky gut, but what's causing the leaky gut? This is giving you that precision that we all want, because we all deal in precision medicine. Anybody else? Yes, ma'am. Have I seen people with no zonulin? Listen, not everybody's got a zonulin problem. Most people have some form of a gut problem, because remember, you could have stomach issues, you can have digestion issues. Yeah, not everybody. 21%, according to Fasano and KBMO. But that doesn't mean 21% have leaky gut. That just means they have a tight junction issue. Yes, ma'am.
If we're going to order it, does the patient get a mail, like the finger poke, and they do it themselves, or you do it in the office?
You have an option of either. So that's what I love about it. They can do obviously they can't draw this way. In the office, you have the option of draw, serum, or finger. You also can send the kit, and they can go to like a LabCorp or phlebotomy or whatever, or do the finger spot. That's why I like the finger spot so much. And the finger spot measures very closely in accuracy to the serum.
And it can also do the 176 finger spot?
Yes. Yes, 176 plus food additives, and I did not say, excuse me, Candida, with the zonulin now coming in.
And they do it themselves?
Yeah, and go. It's kind of like the glucose stuff. Yeah, I think that would be the best way to describe it. No worries. Anybody else? Because it is 1 o'clock. Guys, thanks so much. If you have any questions, I'll be at the booth for the next few minutes. Have a great day. Enjoy your learning.